Cancer is an equal opportunity disease. It has no respect for age, sex, race, or income group. We're all subject to get it, but it's how we handle it that's important. Stay with us when we talk about cancer and the American Cancer Society.
Kentucky Health addresses the healthcare concerns of all residents of Kentucky and surrounding states. It was created by Dr. Wayne Tuckson, a colorectal surgeon practicing in Louisville. Here is your host, Dr. Wayne Tuckson.
Hi, and welcome to another segment of Kentucky Health. Today we want to talk about cancer, but not so much just cancer, but the support that goes around for individuals who have cancer. And one of the leading groups that's out there providing education, not only to the populace, but also to physicians, is the American Cancer Society. And we have a very, very active group here in Kentucky. And with us today we have Ms. Ellen Schroeder, who is the State Health Initiatives Director, and Dr. John Huggins, who's a volunteer. Thank you both for being with us today.
Thank you.
Ellen, let me start with you. What is the American Cancer Society? Because it seems like there's this big, huge organization.
The American Cancer Society is a national organization, but we are community-based. We are the largest voluntary organization in the world, and in this area alone we have over 1,500 volunteers who provide our patients with services. Our mission really is to eliminate cancer as a major health issue for Americans. And we do that in 4 ways. First of all, through funding research to find a cure. Obviously, we're trying to do a lot with education, educating people about, how they can reduce their risk for cancer, where they can find screenings, that type of information. We do a lot of work with advocacy, where we are fighting cancer from a political standpoint. And then finally, we do a lot with patient services, and that's really what we would like to highlight today, because there's a lot of things that we do in the community that people aren't aware of. So we brought some of our volunteers, and we want to talk a little bit about what we can do for a patient once they're diagnosed.
That's an interesting point, because I must admit, I get frustrated, my own personal bias, I get frustrated when I see so much money being requested and all this, and I see a lot of the money go for, we're going to say, okay, we're going to do research, we're going to do this. But there's services that need to be provided, care that needs to be provided now, and that seems to be overlooked. So this is something that the ACS, American Cancer Society, is interested in, making sure that services are being provided to patients?
Oh, absolutely. Last year alone, we served over 9,000 patients in just this area. And when you look at newly diagnosed patients, there's about 24,000 patients who will be diagnosed with cancer in Kentucky each year. So, right now we're reaching about 1/3 of the newly diagnosed patients. Our goal is really to get that to more like 80 and 90%. So really, we want to tell our story because we have such wonderful services and we want people to take advantage of them.
John, you are a tireless worker. I know you're involved in many, many things in the community, and it seems like every time there's something for cancer, your hand is first or you're first in line. How did you get involved in all this?
Well, I'm a cancer survivor, going on 17 years. Hopefully it'll be 17 years in May of this year. And as I was going through my bout with cancer, I said that if I'm able to beat this, then I will give back to the community. And since I finished all of my treatments and everything some 16 plus years ago, I've tried to dedicate myself to doing that.
How has it been for you to get involved? Do you feel like you're an integral piece, or do you come in there and they say, okay, we want you doing this, this, and this? How does it work?
Well, it's a combination of both. The skills that the Lord blessed me with, I try to share those with other people. And so I think there's an opportunity for anyone who wants to participate to bring their talents to the table, no matter how small or how large those talents are. So whatever I can offer, be it information, be it leadership opportunities, doing seminars or talks to individuals or groups, I try to do that.
Well, not everybody is comfortable speaking. Not everybody has a lot of money to donate. Do organizations like the American Cancer Society, do they want workers who are going to come in there and chip in and do things?
Sure, sure. I mean, it's a volunteer organization, and like I said before, there's opportunity for anyone who has talents and skills to come and bring those to the table. There's all kinds of things that need to be done. As Ellen was talking with the service end, people to drive people to appointments, talking to people. One of the things that I do on occasion is talk to groups of men and women about cancer. You know, it doesn't necessarily have to be about a specific type of cancer, but just cancer in general and health issues in general. Again, trying to educate and raise the awareness, if you will, of not only cancer, but cancer-related diseases and other diseases within our community. A lot of times people are not aware, people don't know. And not only do people need the knowledge and the information, but they need encouragement. They need to be able to see somebody who is a survivor. You know, when I was diagnosed, you know, you get that old thing that, oh man, I'm gonna die, you know, and that's not true. And so people need to see people who are survivors. You know, again, I'm going on 17 years, and obviously there are people who have survived much longer than I have. But then on the other end, there's people who didn't. But letting them know what I was able to do and what I did, so that maybe they can take some clues and some lessons from that, because early detection is so key to the survival thing.
How do you look at the mission of the American Cancer Society and how you can apply it here to the state of Kentucky?
Well, the mission is to eliminate cancer, and to do that, we certainly need to continue our fundraising. Obviously, that's a key issue. Money is key. But I think more importantly, our volunteers, as John was saying, are the most important thing that we have to offer. Because, you know, you asked, is there enough work for them to do? It's amazing the amount of things that we could ask volunteers to do. And without volunteers, we cease to exist. Our volunteers, not only do they drive patients to and from treatment in order to help them finish that treatment, they provide support, walk the walk with them. And you'll meet a couple volunteers who do just that, provide that support and that hope. But we have volunteers who do things like provide education about how to deal with appearance-related side effects. You know, they talk about the Look Good, Feel Better program, for example. It's a very neat program in that way. There are volunteers who help people find ways to get to clinical trials. You know, there are just a whole variety of things that we feel like we do for the patients that will help us to eliminate cancer. And if nothing else, it will help allow us to, you know, provide those patients with hope and give them increased quality of life while they're dealing with the illness.
So it's not only just curing, but also handling and how one copes with these illnesses also. What about for families? Because that's a big problem
That
too.
is a big problem. Families and survivor issues are key to the American Cancer Society, and a lot of our support networks are just about that issue. www.cancer.org is a wonderful resource for families as well as survivors to contact, because by looking at that website or calling our 1-800 number, they can talk to a counselor and get all sorts of resources that are available to them.
Well, are these services provided throughout the community, or is it just one location within the community that we find these things?
We're all over the state of Kentucky, so I mean, when you ask that, I guess I'm...
No, that's what I mean. So it's not just here in Louisville where we're taping this
no.
show, but if I'm in Lexington or if I'm in Pikeville.
The easiest way to access and to find out what are the local resources is to call the 1-800 number, 1-800-ACS-2345. When somebody calls that number, immediately they can look up their zip code, and the counselor will spend as much time with that patient or that family member or just an information seeker. A lot of times people call us just to find out, you know, I have this symptom, what shall I do? Or my doctor told me this, what shall I do? And so that gives them an opportunity to get a lot of information. And so that's the best way to find the information available in your community, by utilizing that 1-800 number. Opens the door.
Okay. John, I know one of the things you've been very active with is something called Relay for Life. Now, what is that whole program?
Relay for Life is the major fundraiser for the American Cancer Society. And basically Relay for Life it's people talk about a relay. It's not where you run, it's where you come to a site and we ask team members to walk around the track. We have a bunch of teams and people participating. It's an opportunity for fundraising. It's an opportunity to provide services. It's an opportunity to help raise awareness, but it's an opportunity for cancer patients, cancer survivors, those who are supporters of those survivors, and others who have an interest to come together and kind of rally. This past year, 2010, the event was at the Prestonia lot over on Phillips Lane, right across from the Kentucky Fair and Exhibition Center. We had over 120 teams that participated, and we're hoping to do better than that this year. But it's an opportunity for people to come together in teams, and teams of anywhere from 3 to 20, 25 people. And it's a fundraiser, you know.
It's an overnight event?
It's an overnight event. It's an 18-hour event. It starts at 6 p.m. on Friday and goes until noon the following day, weather permitting.
Is that something that's just here, or is that an activity that's throughout?
All across the country and in several foreign countries, as a matter of fact.
Right.
You know, there are a lot of organizations that have as part of their mission either the treatment, providing research, or services for patients with cancer. I must admit, when I think of the American Cancer Society, it always seems to be the first one, but do you all work with other organizations?
Yes, thank you for asking that, because a lot of the work we do is through collaboration with our community and state partners, especially on the education piece of it, you know, the early detection and prevention. We work with the Kentucky Cancer Program. We work with all the hospitals. We work with the Department of Public Health, a lot of state and community partners that we have to collaborate with because, you know, together we accomplish more. We can't do it alone, so we have to utilize our community partners.
You mentioned several different things, but one of them was almost political activism when it comes to cancer. So do you all actively get out and talk to our legislators and other representatives to try to push programs?
We have a very active grassroots advocacy group. It's all volunteer-based, and we have a legislative agenda that we follow. Primarily, we work things like, you know, continued funding for breast and cervical screening, for example. Right now, we're advocating again for a colon cancer screening program, which would be near and dear to your heart. And then the other thing that we're really promoting, of course, is a statewide smoke-free ordinance. And many of our volunteers are going to be going to Lobby Day very shortly in Frankfurt, and so we'll be talking actively with our legislators about that.
What about on the national level?
We do so as well. We have a sister organization called ACS CAN, which stands for the Cancer Action Network, and again, it's a grassroots organization who work with state and federal legislators to promote our agenda.
So you go all the way up from the local, all the way up to the federal government as far as trying to get things done.
Absolutely.
If I am diagnosed with cancer, how do I contact you all? 1-800-ACS-2345 or www.cancer.org. What is that again?
www.cancer.org.
Okay, and that would get me to the national organization?
It would, but it always connects you back to the local office. So when you call that number or access that website, you can either put in a zip code or provide a zip code, or you know where you're getting treatment, and they will connect you with the local resources in the office there.
If I was in any region within the Commonwealth of Kentucky, how easy is it for me to find the local chapter of the American Cancer Society?
Extremely easy. Same idea, 1-800-ACS-2345, or of course there are local offices in most of our metro areas.
I hope it's also they have an opportunity to find volunteers as good as you, John.
Well, we're still looking.
Still looking.
The door's still open. We're accepting people every day.
We always need more.
Well, I want to thank you both for being with us. Stay with us as we talk about two particular programs that the American Cancer Society provides to help patients who have the diagnosis of cancer get treatment. Welcome back. Now I'd like to introduce you to two people that make the American Cancer Society flow, if you will. And they are Ms. Liz Fulton, who's with the Reach to Recovery, yes, and Mr. Beck Beckman, who's with the Road to Recovery. Liz, let's start off with you. Reach to Recovery, what is that?
Reach to Recovery is a program. I'm a breast cancer survivor where survivors go out and we nurture other survivors. No one else, you have to be a survivor to be in Reach. We get a call from our coordinator at ACS, American Cancer Society, that says we have someone that's had surgery or newly diagnosed, and would you take this visit? We get information about them and we give them a call. I personally like to visit. The telephone's okay, but when you can be with someone, give them that hug, give them that, make them feel secure, a little support, then I just like that personal touch.
So what's the big deal about the contact that you bring in?
We give out information. We have and we explain exercises, with the doctor's permission. But it's just that only a survivor can know what how another survivor feels. And that's what we try to do, is get out there and give the support, give the care, let them know that they're not alone. I know how you feel, and I can say, I know how you feel.
Okay. Now, Beck, Road to Recovery, what does that do?
Road to Recovery essentially offers transportation services for patients to and from their treatments. Basically, I get a call from a volunteer coordinator who says, what times can you give next week? Because my place of employment is open late hours, I can say, I can take somebody Monday morning at 8 a.m., take them to and from their treatment, and then go to work, and I've done my good deed for the day, to say the least.
That seems like such a key thing, because it seems like one of the big obstacles in people getting treatment is that they can't get to the place where they need to get their treatment.
Agreed.
How'd you do this? How'd you get started?
About 5 years ago, a friend of mine with the company I work for asked me to help get a team organized for Relay. I've grown up always doing volunteer work, and I saw how passionate and how organized the ACS employees were. About a little over 2 years ago, I said, I want to extend my help with you all. That's when I got into the Road to Recovery program, and I've honestly tried to schedule at least one ride a week, if at all possible, if not even more.
Do you wait there with them while they're getting the treatment, or you just make sure they get it and then somebody else makes sure that they get back again?
We can do it where I might drop them off, somebody else picks them up, or if I have the opportunity to wait for them, I like to do that. It gets me an opportunity to maybe text some friends, read a good book, and as soon as they're done, we take them on home there.
When you go out into people's homes, what is it like for you to talk to that patient who has a new diagnosis of breast cancer?
To reassure them, to let them know it's okay, you're going to be fine, you're going to get through this. And it's just a good feeling I can give back to someone else. It's a scary thing. I used to say before my diagnosis, oh, you hear cancer, all cancers, it's not into death, and that's fine until it gets to your house. And it's a whole different feeling, a whole different story. So just to reassure them, to let them know, yes, you can make this, you can get through this. Is there anything that I can do for you? It's a support, sisterhood support.
What is the special thing you think you bring that the physician can't bring into the equation? How do you see it?
If he has not had breast cancer, a lot of times I'd say they probably have not. I can hug them. I can say, I know how you feel, and it's okay. It's scary at times, but you're going to get through this. You're going to make it. And I can give that where no one else can. Is
it scary for you to have to go back and, I guess, revisit your own illness?
As my time gets, I'm almost a 10-year survivor.
I had a
thank you. I had a scare on my other breast for a couple years where I had to go every 6 months. So it makes you have thoughts. But now, as I'm a longer survivor, I'm feeling more secure. I'm blessed. And I would often wonder, why? I don't have it in any family history, and I wonder why. And now I know why, because I had to go through this so that I can give back to somebody else.
Have you found that many of the patients, or any of the patients with whom you visited, have they gone on to become participants in Reach to Recovery?
That I don't know. I know some have shown interest. We tell them where, contact the office downtown, so I'm not quite sure if any have joined, but, we always give them that information.
Do you have to, when you're going to pick someone up, are there certain limitations that that are placed upon you as far as, wheelchairs, not being in wheelchairs, patient has to be able to walk or anything like that?
Typically, the volunteer coordinator will say, the person might need assistance with a wheelchair. Size of car I have, that wouldn't be something that I could help out with. But more times than not, the patient rather is just needing a drive from point A to point B and then back to A there.
Have you had personal experience with cancer yourself?
I've had friends and family who have, but it's more just the passion and dedication by the ACS employees. That is why I've helped them out for so many years now.
How does one go about volunteering to do a participant in the Road to Recovery?
It's open to anybody who gives time and has a car. Basically, they would call the ACS office, ask for Paige Vollmer. At that point in time, there's certain criteria she'll ask you for. Do you have insurance? But a lot of people we have who help us out are retired persons who can offer the time. And then you have a good chunk of people like myself whose employer, I work later in the day. We also have a firefighter and a realtor. So it's, if you can give 1 hour a day, whether it's one a week, one a month, you're helping out a family who maybe the patient just doesn't have transportation, or their loved one has to take off work to drive their loved one to the treatment, and that then in turn cuts into their budget there.
Is this a free service that you provide?
Yes, I have no money off of it there. I volunteer, I don't even write down the mileage, and the biggest reason why is because of how much fun I have with it. I meet great people. I could have the worst week in the world and say to myself, how can it get any worse? And well, it can't get worse. And all my patients, they don't talk about, their treatments. One, of course, is which, because I haven't been through it myself, but, we talk about sports, we talk about family, we talk about, what their plans are for the weekend. And it's like I'm driving a friend, basically.
Do you ever get to know these people very well?
Yes, a lot of times if I say, well, I'm off on such and such days, does so-and-so need a ride? And it's because I got a great rapport built with that person, I know where they live, and it's like a friend. I'm just taking my friend to the hospital there.
Now, I know that with Reach to Recovery, you seem like you form a very intimate relationship with the person with whom you may be working. Do you have to be careful and not provide medical advice to these people?
Yes, we give no medical advice. We listen. We provide comfort, support, and listen. Not to tell my story. They're not interested in mine. I've had my time. I'm there to listen to them so that they can talk and find comfort. And I can say, yes, I've been there, I've been through that, and just to listen and provide comfort. And it's a lot because, like I said, I can say I know how you feel.
Do you ever have to accompany the person to an office visit with their physicians or anything like that?
No, I've only done that with a personal friend, a young woman, and to give her support, I did that. But besides that, no.
How did you find that experience when you helped your friend like that?
It's the doctor that I went to at the time. He's one of the primary physicians he's a surgeon that does nothing but breast cancer now. Used to be a general surgeon, just breast cancer. And it was good. It was comforting. We rallied around her, and it was funny because after we do a visit, we have a report that we send to the doctor saying, yes, we visited, if they've had any questions or whatever. And he recognized my name.
Oh, really?
So, yes.
Do you ever hear back from the physicians that you have sent reports in?
Personally, I don't.
They usually go back to the American Cancer. So if someone is interested, if a woman has a new diagnosis of breast cancer, how are you contacted, or how does one contact Reach to Recovery?
Call the 1-800 number, call the local office. Our referrals, I believe, mainly come from the doctors that call the coordinator at the American Cancer Society. They in turn give us a call. And
they in turn contact you, and then you'll contact those individuals.
Then I'll call the individual. I had one last week. I had a cold, but I'm like, okay, and I call them, and I get in touch with them, get the information out.
And how, again, do we get in contact if we need a ride?
Call your local ACS office. At that point in time, if you want to volunteer, Paige Vollmer can assist you in that. Or if you're already set up in the system there, Sarah Scheidel can get down your name, your number, what hospital you need to go to, and then she coordinates with the volunteer who then contacts me.
American Cancer Society does a lot of good things for us in our community. It helps us in providing for research, treatment, but it also makes sure that we feel good and that we have ways of getting to the physician so we can get the care that we need. If you want to volunteer, please call the number that you see below. And if you have further questions, contact us at Kentucky Health. at insightbb.com, or feel free to contact your local chapter of the American Cancer Society. Thank you very much for being with us today, and thank you both for sharing your story, because it's nice to meet the people who do all the real work. Thank you very much.